Hello, and welcome to today's episode on laryngopharyngeal reflux and the glottal closure index, as presented by Jamie Kaufman. We will be going over each question with a visual representation of each complaint. Speaking takes extra effort. Throat discomfort or pain after using your voice. Vocal fatigue. Voice weakened as you talked. Voice cracks or sounds different. Speaking takes extra effort. When there is a pathological aspect involved, it can cause problems with intonation. The most common problem is infections. Note the redness and slight swollen mucosa, especially marginal redness of the vocal folds, together with the edema of the vocal folds and also mucus. On the right, you have the phonovibrogram. Note that the opening phase in red are extremely irregular due to the infection. Throat discomfort or pain after using voice. Another and worse voice problem is pain and discomfort. It's a good advice not to speak if you have discomfort or pain, and for singers not to use the tones involved. This is mostly the high notes or the notes at the register shifts. We present the vocal fold movements on high-speed film. Note that the vocal folds have slight discoloration. When they move, you see a slight edema in the middle. On the segmentation picture of the rear part of the vocal folds, there is a tendency to irregulation of both vocal folds, and the opening quotient is reduced in the center and the front area. When people sing or speak with pain or discomfort, they press the voice, which is possible to see on the high-speed films. Mostly there is also mucus on the vocal folds. This picture shows a chomography of a high-speed film, how the larynx is pressed together before the intonation of the vocal folds start. Even the first 10 to 15 cycles are so pressed that it's just one wide area. Vocal fatigue. Voice weakens as you talk. Voice fatigue is mostly a result of disobedience to the body's own signal of discomfort or pain. Trauma of the vocal folds and the mucosal take a long time to rebuild, just as any other muscle in the body. To become conscious of voice production is a good idea. Sometimes you can see reduced movements of vocal folds, and the clients tend to press the whole larynx. In this video, slight reflux indices with insufficient closure in the rear part of the vocal folds and slight edema in the arytenoid region. To the right, we see a film of the margins of the vocal folds where the insufficient closure is presented. Underneath, we show the segmentation where the rear lack closure. You can see there is no connection between the dark blue and the teal line, which represent each vocal fold in the rear. For your orientation, we also present the front, right, and left movements where the connection between the vocal folds is pressed, seen by the fact that the right and left vocal fold overlap. This corresponds to the picture below of the phonovibrogram, where the opened phase is reduced in front and doesn't close in the back. Note that the opening quotient is 1 in the rear and 0.83 in the center and 0.5 in the front. Another typical finding when people complain about vocal fatigue and vocal weakness is the accumulation of mucus due to the underlying dysregulation of the mucosa. Voice cracks or sounds different. That the voice sounds different is a subjective complaint. There is an old test where you can describe resonance, roughness, and cracks, which can be described as vocal fry or raspy sound. High-speed films can show pressed voices, irregularity, and insufficient closure. In this video, you can see that the vocal folds are pressed significantly against each other. By searching the literature, the problem with subjective complaints is described by Ruhl and Thibault. Voice handicap index is used by the patient to report the symptoms, but the authors do not find correlation between vocal effort and voice handicap index. They suggest an underlying mechanism for vocal effort of altered glottis function. Thank you for watching, and we'll see you in the next one.